Thank you, Mr. President. What I was going to say in some preliminary remarks before going through sections of the bill was that over the last 4 days, really since we adjourned on Thursday, there's been some really good work done on this bill in regard to some questions that were posed by the senator from Greenville, Senator Loftus, and the senator from Charleston, Senator Campson, and others in regard to why could we not, instead of establishing a new system or network of dispensaries to get medical cannabis in the hands of individuals who had been authorized to have it by their physician, why could we not take advantage of the skill and expertise that pharmacists possess, and particularly in regard to their ability to interact with patients at the dispensing level, to answer questions by the patients in regard to the medication, to be a source of information for patients in the event that there was reactions to the medication that were perhaps unanticipated by the patient. And so hearing those questions on Wednesday and Thursday of last week, I said from this podium, and I resolved to look into what other states had done in that regard and to see whether or not that was possible. And what I found was it is, in fact, possible. 3 states, 3 of the 37 states that have authorized cannabis for medical purposes utilize pharmacists in connection with the dispensing of authorized medications to patients. And so I first started by reaching out to government officials in the state of Louisiana. They had passed a law that has pharmacists in the dispensing component of the program. Spoke at length with officials there. Then spoke with the South Carolina Pharmacy Association, and they engaged in the process. They shared information in regard to if you wanted pharmacists to be involved in this process, here's how it could be done. Worked at length with Senator Cromer, senator from Newberry, who is, as you know, a professional pharmacist, to get his input on it. Particularly thanks to my friend Senator Kimbrell, Senator Spartanburg, who really did a good job of taking the information that was received from the Louisiana officials, the South Carolina Association of Pharmacy, Senator Cromer, and quite frankly also from a group that has been historically, or not historically, the past few weeks, an opponent of this bill, the Palmetto Family Council, who, and I went back, and this is one of the things that I hope I've learned over the years that I've been in the state Senate from Lexington, and this wasn't always the case with me, but it is possible that sometimes I'm not entirely correct, or perhaps what I put forward can be improved, and that if you have an open mind and open ears and a willingness to engage, you can really benefit from principled opposition. And quite frankly, that's the only way you really get good legislation, is if you have principled opposition, which of course is the function of the subcommittee process and the committee process, but it continues even on the floor. And by having that principled opposition, your assumptions are challenged, or you know, what you expect the consequences can be challenged. And then if you listen and if you engage, which is what I've done over the last 4 days, you can learn something even from foes of your bill, and you might often find them sometimes becoming allies of your bill. And I'm not going to belabor the pharmacy amendment that Senator Kimbrell is going to offer at some point in time, but I wanted to let the body know that that process had taken place over the last 4 days. A lot of work I spent this weekend on this to get it ready. And really, I would make this observation. It's a reflection, or you know, a manifestation of what I said I hoped would happen when I began this debate on Wednesday, that everybody would engage in this process, offer ideas to make this bill better. Because even though I've worked on it for 8 years and put a lot of time into it, you know, there's the knowledge problem that Hayek talked about. You don't know everything. You can't know everything. You've got to rely upon others. And so that's an example of that. So I wanted to point that out. Now, in jumping into the mechanics of the bill or the sections of the bill, I'm predominantly going to go chronologically, or at least in terms of order that they appear in the bill. But I think a constructive way to engage some of those sections is going to be in regard to the letter that the South Carolina Solicitors Association issued to the President of the Senate, I think it was last Thursday. This is a very productive and constructive letter that I would commend the solicitors for writing, because what the solicitors did was they talked about how they believed 150 was inadequate and that they opposed it in its current form. But it did more than that, in that it then proceeded to, with specifics, identify exactly why they opposed it, which of course provides an opportunity, such as with the Palmetto Family Council, to work on amendments or to work on things that would address those concerns. And so that's the way I'm going to start this particular process of dissecting the bill. And referring to that letter from the solicitors. The first thing they noted was they opposed 150 because there was the absence of adequate regulations necessary to deter fraudulent acts. Okay, that's a quote. The absence of adequate regulations necessary to defer fraudulent acts. Okay, and that refers to the following section of the bill, which gives me an opportunity to talk about it in a useful context. On page, let me see, line here, in section it's on section 44-53-2130 in subsection A, subparagraph 7. And that states as follows, that there must be a statement signed by the qualifying patient applicant agreeing not to divert cannabis products to anyone who is not allowed to possess cannabis products pursuant to this article, and acknowledging that the diversion of cannabis products is a felony that, upon conviction, results in the revocation of a registry identification card and subjects the qualifying patient to a fine of not more than $5,000, imprisonment of not more than 5 years, or both. So in regard to the absence of adequate regulations necessary to deter fraudulent acts, that is one thing I would point to in regard to what would currently be a misdemeanor in regard to possessing cannabis. In many instances would become a felony under this law if you possess cannabis under the auspices of a medical license, but you then use it for recreational purposes. So that's one example of a deterrent that's in here. Another example would be in section 44-53-2230, subparagraph C, and that continues on to the following page into subsections D, E, and F. These are the anti-fraud provisions of the bill that the solicitors are wondering if they are strong enough. And under those particular sections, section 44-53-2230C says that, notwithstanding any other criminal penalties related to unlawful possession of cannabis products for medical use, knowingly making a misrepresentation to a law enforcement official of any fact or circumstance related to the medical use of cannabis products to avoid arrest or prosecution is a misdemeanor, and upon conviction punishable by a fine of up to $1,000, in addition to any other penalties that may apply. So I think perhaps maybe the point the solicitors are making here is that the act of making a misrepresentation to a law enforcement official in regard to possession of cannabis, ostensibly for medical use, that perhaps making that a misdemeanor is not an adequate deterrent. And I think that that's something that we can explore, and perhaps we can look at through amendment. Again, I'm taking their letter in the spirit it was offered, which is, how can we make this bill better? You know, they've poured through this bill. They've given very specific lifted very specific concerns that should be taken seriously, and that's one of them. The anti-fraud provisions continue on the following page, or in that section, still on section 44-53-2230, into subparagraphs D, E, and F, and I won't belabor the point, but it makes a similar a misdemeanor out of, well, I'll just read it. Notwithstanding other criminal penalties related to the unlawful possession of cannabis products for medical use, knowingly making a misrepresentation of a medical condition to a physician or fraudulently providing material information to a physician is a misdemeanor. And again, it goes to that fraud aspect of it. In this context, the fraud contemplated would be the patient sitting down with a physician for the purpose of getting a written authorization, and that patient knowingly or misrepresenting their medical condition to the physician for the purpose of obtaining that medical cannabis card. That is a misdemeanor, and again, we can explore whether or not making it a misdemeanor is or is not an adequate deterrent. And it continues along the same lines in regard to an individual who also in regard to any qualifying patient who commits a violation or refuses to properly request a test relating to operating a mode of transportation while under the influence of cannabis. So you must have your registry card revoked if you do not cooperate with law enforcement in regard to being challenged if you're driving under the influence. If you don't produce your card, if you don't cooperate with the law enforcement, you're kicked out of the program. Again, we can talk about whether or not that is an adequate enough deterrence, but I appreciate the solicitors bringing that to my attention so that we can talk about whether or not it is. The other thing that the solicitors noted in their letter was, and I'll just read briefly, while the National Academy of Sciences reported in 2017 that there may be health benefits associated with the therapeutic use of cannabis, well, I'll stop right there. They reported there was conclusive evidence of health benefits. They didn't say there may be. They said there was conclusive evidence of health benefits, but nonetheless, continue on. There is also evidence that links cannabis with increased risk of medical conditions, of developing or aggravating other medical conditions. It then says it is not wise or responsible for government officials, rather than science and medical experts, to determine the conditions medical marijuana may be safely used for. And this is a point I want to, I addressed it with Senator Cash last week. It's important to understand that in defining the universe of qualifying conditions for which medical cannabis can be authorized by a physician, the General Assembly is not acting as a physician. The General Assembly is not acting as a pharmacist and dispensing and saying, if you have one of these conditions, you then have the right to receive medical cannabis. What we're doing in this bill, and this is fundamental to the bill, is we're empowering a physician so that a physician in inpatient consultation with the patient has the ability to authorize the use of medical cannabis to treat a condition if that physician believes it's going to be medicinally beneficial. Because simply because cancer or epilepsy or Crohn's disease or chronic pain, simply because it's listed as a qualifying condition in the bill, does not mean by any stretch of the imagination or any reading of the bill that the patient then has a right to receive medical cannabis because we listed that as a qualifying condition. All that list of qualifying conditions does is empower that physician for that physician to do what he or she believes is in the patient's best interest. That's all it does. And so I think and that misunderstanding about what we're doing here creeps into this letter by the solicitors when it says it's not wise for government officials to determine when medical marijuana should be used. We're not. We're not. We're simply empowering doctors. And as I said to the senator from Anderson last week, if I had my way, there wouldn't be any qualifying conditions constraints, and we could place sole authority for what's good for that patient in the hands of that doctor. That doctor's the one that's been to the medical school. That doctor's the one that's done an in-person diagnosis with that patient. That doctor has the ability to ask that patient questions. That's the relationship out of which the authorization of cannabis use comes, not by this General Assembly, okay? But I recognize that there is some trepidation about treating cannabis as medicine and the potential for abuses. And so that's the reason why there is a constraint on the authority we're giving to physicians. Because of that doubt, because we don't know exactly how this is going to work. But don't infer from that, don't infer from the fact that we list qualifying conditions that we're somehow acting as doctors here, or we're acting as pharmacists here. We're not. We're simply empowering a physician. And I think that's a critically important point to make. Another concern expressed by the solicitors was in regard to impaired driving and the lack of there being the equivalent of a blood alcohol content test that could be given to somebody who was driving under the influence of cannabis. And they reached the conclusion that law enforcement and prosecutors will not be able to arrest and successfully prosecute impaired drivers with THC in their blood and needless deaths and prevent needless deaths on our roadways. Well, that's true in regard to there isn't a test for THC that is as reliable as the test for blood alcohol content that's currently when you use a breathalyzer. That's true. But it is not true that in the absence of such a test that you cannot arrest and successfully prosecute somebody for driving under the influence, because there are field sobriety tests, there are standards of engagement in regard to when somebody is driving impaired under the influence of marijuana. There are things you look for. There are protocols that have been developed in other states. There is guidance for our law enforcement when they're out there trying to make that determination. So I would just point out that that's the same problem they arise in regard to some other prescription drugs that may be in somebody's system. And it's hard, you don't have a blood alcohol content equivalent to detect those drugs, and yet opioids are legal and other prescription drugs are legal. And so I would submit that the fact that there isn't that level of testing in regard to cannabis is not a reason for opposing this bill. And again, and I know I'm going to have a disagreement with some of my friends in opposition on this bill, but I've come prepared with 5 peer-reviewed studies over a period of 25 years that, again, show that there is a direct correlation between states that have medical cannabis laws and an overall decrease in traffic fatalities, because marijuana and alcohol operate primarily as substitute goods, okay, not complementary so much, but substitute goods, and this is demonstrable not only across a number of states, but also by the Federal Department of Transportation. And I'm going to make that information available to this body, because it's simply not true to say that in the event you establish a medical cannabis law, you're going to see incidences of impairment go up and fatalities go up. The data and trend lines in these comprehensive studies show the exact opposite. The next section of the bill that the solicitor's letter invites me to talk with you about, it says that S150 fails to provide restrictions on the form cannabis products may be made available and distributed. In keeping with the bill's focus on cannabis use for medical purposes, the sale of cannabis should be heavily regulated to define allowable products, with restrictions regarding cannabis plant material, edibles, and new products are developed in the future. Access to and packaging, storage, and display of allowable cannabis products must also be regulated to adequately provide notice and caution of various risks, including accidental consumption or use by young children. Other states have banned many types of edibles due to their attraction to children. Okay, so in addressing that, we have a chance to look at the bill, and I can talk about some of the sections here. First, in response to that expressed concern, I would go to section, this is the definitional section of the bill, which is section 44-53-2010, which defines various terms. And looking at subparagraph 14, it says that it defines exit packaging, which later in the bill says this is how cannabis product must be dispensed to patients. That means, quote, a sealed, child-resistant packaging receptacle into which prepackaged cannabis products are placed at the retail point of sale at a dispensary. So that's one instance in which we do regulate in regard to packaging. Another example, again, turning to the bill, and again, I won't go over these sections again. As I chop them off here, I'll make a note. Line 14, this is in section 44-53-2350, subparagraph A, subparagraph I, subparagraph tiny I. And this is setting forth various regulations that are to be issued by DHEC. Requirements that the medical cannabis establishment's logo, advertising, and signage be tasteful, respectful, and medically focused, and must not appeal to minors or contain cartoon-like figures or attempts at humor. Requirements that medical cannabis establishments submit any logo or sign for review to the department in accordance with department regulations. Prohibitions on medical cannabis establishments from using marijuana leaves or slang for cannabis or cannabis products in or on their signs, logos, packaging, or structures. And then limitations on the size and location of signs, and prohibitions against using neon-colored signage, logos, and packaging, or neon-colored signage or logos or structures. So when the solicitor's letter talks about there not being regulations in regard to the packaging, storage, and display of cannabis products, I would look to those particular sections of the bill. And again, I'm open to the idea of making those provisions better, but it's worth noting that the bill does do exactly the sort of things that the solicitor's letter rightly says it should do. It does regulate and provide restrictions regarding plant material, edibles, and products. It does provide restrictions regard to packaging, storage, and display. It does talk about how it's marketed. It does talk about child-resistant packaging. It does talk about those things. Now, having said that, I'm open to and I'm engaging with the solicitors in how we can make it better. Again, I take this as I took the Palmetto Family Council's comments. I take it as constructive criticism and as an attempt to make the bill better. And I'm taking this bill or this letter that's being submitted here with that same spirit. The next thing the solicitor's letter notes is that before a bill with such risks and potential negative impact is enacted, the legislature must be sure that DHEC has a viable plan for developing a new program that minimizes these risks and that the appropriate funding is available. And so in that regard, the next section of the bill that I would like to explain is section 44-53-220, subparagraph A, which talks initially about the funding for DHEC to administer the program, the concern that the solicitors are expressing here. It states that the department, meaning DHEC, shall establish a South Carolina Medical Cannabis Program Fund to ensure the availability of funds necessary to carry out the department's responsibilities under this article. All monies collected pursuant to this article must be deposited into the fund. The fund must be used for direct and indirect costs associated with the implementation, administration, and enforcement of this article. The next, turning to the next section, section 44-53-2030, it states as follows: notwithstanding any other provision of the law, the department, again meaning DHEC, may implement a reasonable fee increase to be charged and collected pursuant to this article if necessary for the department to cover the cost of administrating and operating the program pursuant to this article. And then immediately following that, in the next section, section 44-53-2040A, it then says that all sales of medical cannabis products are subject to a 6% sales tax at the point of sale. So now turning back to the solicitor's letter and stating that we need to be sure that DHEC has the appropriate funding, I will represent to this body that in well, I can't say the 37 states because Mississippi has just started their program, but in the 36 states that have medical cannabis programs, they operate over time using fees and revenues derived from that particular program. They don't rely on the general fund in the long term. Now, what I will say to you is that initially, when we're initially setting up DHECS protocols and registries and things of that nature, and if SLED, needs to have, some FTEs, there may be some initial general fund impacts in regard to establishing this program. But I represent to you that over time, it not only covers the cost of administering the program, it is a revenue generator, okay? And I've never positioned this bill or argued for this bill in the context of it being a revenue generator, because I've always been careful to constrain the fees and the taxes to those being what is necessary to cover the cost of administering the program, because medical cannabis is going to be something that patients have to pay for out of pocket. It's not covered by insurance, and it's not my desire to drive up the price and keep medicine out of people's hands. But when I'm confronted by a statement that says that the bill doesn't provide adequate funding and that DHEC is not going to have the resources necessary to implement the program, I do need to push back. That is not what the experience in the other states that have legalized medical cannabis have had. Aside from the initial general fund impact, which I acknowledge is going to be there until you get protocols in place and cards issued and physicians' authorizations given and actual cannabis purchased, you're not going to have the revenue streams initially that you're going to have subsequently. But I did want to point out those sections of the bill that do provide for funding, fees, and a sales tax. The last concern that they have is in regard to the following section of the bill, which is Section 44-53-2390, subparagraph I. And this relates to, and this is the criticism or objection offered by the solicitors, the bill should apply the same lifetime prohibition to marijuana establishments as it does to other medical facilities and establishments. What they're talking about is that this bill prohibits an individual that has been charged with a felony drug charge from working or receiving a license to operate an establishment that sells marijuana for 5 years. Yet under our current law, individuals with a felony drug charge cannot ever work in a pharmacy or doctor's office, even after 5 years. So their concern is that this disqualification in the section I just cited to you says that you can serve in a medical cannabis establishment, even if you've had a felony, if that had occurred at least 5 years prior. What they're saying is they want it to be a lifetime ban. If it is the opinion of this body, of this Senate, that it is important to have a lifetime ban on an individual who has a felony for a drug-related offense from ever working in or owning a medical cannabis establishment, again, I take this letter as constructive, and we can have that discussion. And finally, I want to conclude by this particular part of describing the bill by, complimenting the solicitors on how they closed the letter. It said, "We recognize the hard work and thoughtful intent of the bill's drafters, and we are happy to assist the legislature." So they're not only looking at the bill, expressing specific concerns, they are saying we are willing to sit down and work with the legislature in addressing those concerns. And that is what I am doing. And so I wanted to take that opportunity to go through the solicitor's letter, and that would give me an opportunity not only to talk about what I think is a constructive process, but also start to tackle some of these sections of the bill in a context in which maybe it would have meaning other than if I was just rolling through it chronologically. But then turning back now to where I think we are in the bill in terms of what we haven't covered yet, I do think we've gone through Section 44-53-2080 that talks about the written certification form that a physician must issue before he or she can authorize cannabis use by a patient. And I don't want to plow that ground again, but I would point out to you that Section 44-53-2080 sets forth some very high bars that the physician has to cross in order to authorize the use of medical cannabis. And it relates to a number of things ranging from, the treatment history and what the patient has tried in the past and finding out what the patient's history of alcohol and substance abuse has been, whether or not they've had a history of mental illness or psychiatric disorders. I mean, I'll just suffice to say it's an exhaustive list of things that the physician has to do before he can authorize or she can authorize cannabis for use by a patient for a specific qualifying condition. And that's important because in a lot of states, what I found in investigating them is a lot of times it's simply a cursory review by physicians, or a patient can just drive by to somebody in an office, step in, get a written certification, and then that patient goes out and gets the cannabis.